Hi, my name is Kirsten, and I'm a speech-language pathologist here at the Benefis Pediatric Therapy Center at the new Women's and Children's Center, and I've been a speech therapist here for about 7.5 years.
My name is Stasha. I'm a pediatric occupational therapist, and I have been here for 2.5 years, and I specialize in sensory-related behaviors in our pediatric population.
We're really excited to talk with you guys today about communication and sensory needs within the pediatric population.
So something that we might see is a good way I like to explain it is when someone has a typically functioning sensory processing system, we all value at a 50% baseline. So we're all kind of in the middle. And when someone has an over-processing or an under-processing, instead of starting at a 50, we start higher. So for example, if someone were to knock on the door, my sensory processing system would kick in and my hearing would say, okay, something's at the door, and then I'm going to turn and look. My vision is going to spike up. So instead of being at a 50, I'm already maybe at like a 60%. And when someone or a child has an over-processing sensory system or a sensitive processing system, instead of being at that baseline of 50, we're already at a 75. So if someone knocks and does that same scenario, instead of me just identifying the stimulus that's happening, I am going to go to my fight or flight, and I'm going to process up to a 85 to a 90%. And that can cause an over-exaggerated behavior. So it could look like me standing up and screaming. It could look like me holding my ears. It could be me rocking in the chair because I'm really nervous and I don't know what that is. So those are some things that kind of help us identify if there are sensory challenges in our kiddos. Some other things could be it's really hard for me to sit in a chair during school or during feeding time, and I might sit and I might bounce, or I might stand up and eat instead. Some other things you could have are simply like touch. So I can't stand the touch of jeans, and therefore I am really upset about it all day long, and I might be scratching at my legs. I might be trying to pull them down because I'm really uncomfortable, and it could be simply because the touch of my jeans, the texture of them, are too rough. So maybe I like to wear sweats more, and that's okay. It could even change with, after you wash your sweats 3 times, it gets that rough feeling. That's something that could impact us too. So those are all kind of things that we need to look at when we see those kind of behaviors that are occurring.
The first step in identifying any communication difficulties within your kiddo is to contact your referring physician or your primary care physician. They will be able to go through a checklist with you to see if speech therapy services are warranted and if that's the next appropriate step for you. The great place to do this is your well check. So doctors have a really great system set up. So you go in every milestone amount, usually is it 6 to 8 months? 6 months, or on those early years, and then they can determine whether or not a referral is needed to send to us. Another great resource for you is ASHA.org. That's the American Speech and Hearing and Language Association. And what they do is they provide you with resources for parents and speech therapists, audiologists, to be able to provide education for the community regarding developmental milestones. So you can even type into Google birth to 1, 1 to 2, developmental milestones, ASHA, and they'll be able to tell you a little bit about what you're supposed to be doing at a certain age. Right now, in December of 2022, they are currently updating for the next year, so they might have a little bit of differences between December to January for those milestones. But first, I would always go to your referring physician for any communication concerns that you might have for your child.
I believe that also in general, just if you also, there's some gross motor, fine motor milestones too. So if you ever have besides just speech. You could also make sure that we're hitting our milestones for gross motor, for play, for fine motor skills, because those are also really important. And like Kirsten said, the best strategy would just be to go into your primary or the kiddo's primary and just get your well check done and see how they're doing, because the physicians are great at knowing what those milestones are, and they refer accordingly. So they're a really good resource to use. This is a really great question. So it's really important to start sensory exploration or sensory play in general right after birth. And you want to grade those sensory play skills according to the age. So for example, like a great way to get some sensory play in, and we tend to do this without even knowing it's sensory, but that skin-to-skin contact is so important for our kiddos and for development, but also to create that connection between parent and child. So that's a really good one to work on, that tactile. Another one would just be simple play strategies. Tummy time is really, really hard for our kiddos, but it's so important to do. So to make it more intriguing to them and getting sensory exploration, you can have them lay on their belly using something like a boppy pillow or a blanket, something where they're supported and their head is up in a good position. And then you can put shaving cream, is a really good one. You can put shaving cream in one of those big gallon baggies and put some paint in there and tape it to the floor. I would recommend doing this on a hardwood floor. And you tape it, seal it, and then have them just bat at it. And that's a really good one, not only for tactile, because they'll touch it and then they'll look and see there's nothing on their hands, but it's really good visual input too, because you're mixing the shaving cream with the paint. Visually, it's really stimulating, but in a positive way. Kiddos typically don't develop that vision of color right away, but that's a good way to process that. So you can start with really simple colors like red, black, those kind of colors, and then generally build up to more advanced. Again, it's very important to grade these activities as you go. So infant, for some movement and allowing them to get some proprioceptive input and movement, is allowing them to sit on something that is a dynamic surface, meaning it moves. So something like a ball, and you sit behind them and you support them on their pelvis. Be very careful. You can't tip the ball quickly because their core strength is not developed yet, but just slowly lean side to side and they'll get those reflexes in. That's a really good one to use as well. And as you get older, so let's go to our toddlers, you can do things like rice bins. That's really good. You can put their little toys or something that are safe, put it in rice, and they have to dig through the rice to get the toy out. And then, big claps and lots of surprises. And then you can keep going. You can do things like, as you're getting older, let's say we're 5, and then you can do things like obstacle courses, tunnels. That's a really good sensory component. It gives us a sense of regulation and a sense of calm because we get all of our movement out. We have to get executive functioning. How do I get from point A to point B going through this tunnel? You're getting crawling, you're getting input through your joints. So that's a really good way to get that sensory exploration in. A good resource you guys can look into as well is it's called the Sensory Project, and if you just type that into Google, she has some amazing, she's an occupational therapist as well, and just has really good strategies throughout our stages of development that can help with regulation and sensory as well.
And something I want to add to that, Stasha, everything with sensory process or sensory exploration, I should say, can be combined with vocabulary development. So that's what makes it a great activity, is that you can target so many areas of development in one task. So for instance, with that little kiddo you were talking about, maybe it was the shaving cream or the, what were you saying, the paint?
The paint, yeah. Yep.
You can look at the hand and go, ew, or uh-oh. What a great exclamatory word to use with this activity.
Yes.
The next stage of the toddler in the rice, you dig in there, you can use words, dig, 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 action words, ooh, wow, oh, yes, grainy, wow, descriptive words. And then that last situation with the obstacle course, maybe your 5-6-year-olds, you can use things like superlatives. Oh, do we want to use the big ball, the bigger ball, or the biggest ball? And so you can cater vocabulary learning and development with your sensory exploration activities as well.
Yes.
So Proloquo To Go is a communication app for those of you who are not familiar with that vocabulary. It's a communication app for kiddos or adults who have difficulty communicating verbally. Is a speech therapist advised in using a communication app like Proloquo To Go? I would say definitely yes. Proloquo To Go on a communication device such as an iPad is considered durable medical equipment, just as oxygen or a wheelchair or crutches. And those are all things that we would definitely consult a medical professional with to size those pieces of equipment to your personal needs. So the question was specifically, how do we teach kiddos to use communication apps such as Proloquo To Go? There are a variety of ways that we teach kids and parents to use these devices. We have to first assess their motor skills, their vision skills. We often are in work with occupational therapists, with physical therapists, even to get positioning to the device. How are they accessing it? Can they use their fingers to touch this device? Do they need an eye gaze to access the device? Are they able to have the cognitive skills such as memory, sequencing, attention to be able to access this device appropriately? There are hundreds of different communication apps such as Proloquo To Go, and so it is important that we talk to a speech therapist to be able to evaluate and to provide the necessary app or communication style that's appropriate for that kiddo, and we can definitely cater those needs for each kid's. Another thing I'd like to say about that is it's important for us to be able to help you as much as we can financially. A lot of these apps are very expensive. That specific app right now is about $250 out of pocket. So if your insurance does cover an app like that, we want to help you. We want to be able to get that covered for you. And that's something that we can do if you come into our office, possibly, if it's appropriate for your kiddo. Also, if a use of a device is necessary, that does mean that your kiddo might have a severe communication difficulty. And if that's the case, we definitely want to see why that is so that we can treat from the foundation versus just treating the symptoms of that. I often give an example of a kiddo if we decide if the parent thinks they need to be in a wheelchair and they probably don't just go and buy a wheelchair and put them in. They want to see, why is my kiddo needing a wheelchair? And so that's something that I would definitely recommend that you first contact your physician to get a referral for speech therapy, and then we can investigate the matter further.
If your child is acting out in an angry related behavior or aggressive, so we're fighting a lot, we have a really hard time with behaviors specific to parents or siblings, those behaviors might be more appropriate for a referral to a behavior analyst or a counselor, something like that, because they know their scope of practice to address those behaviors. An appropriate referral or to come see occupational therapy for behaviors would be something that is sensory related. So again, kind of going back, my child has a temper tantrum when they're wearing jeans. That is a great referral source for OT because we can address those tactile sensory processing issues. My child is really struggling to be able to sit at the table to do their homework. We get upset when I ask them to sit for more than 5 minutes. Again, that's a good referral for OT, and we can work on the processing system of being able to sit and control our bodies. Maybe we can add some adaptive equipment to let them have those movement needs without actually being destructive or distracting to what they're supposed to be doing.
And another way that behaviors might be presenting in kiddos that would be appropriate to refer to speech therapy is if it's related to any communication breakdown. So for instance, if you have a toddler who want something really bad but can't communicate, I want juice, and they just go, and they start throwing their bottle at you or throwing something at you, that would be an appropriate referral to send to us, because that shows that they're struggling with communicating to you, I need this in my life, or I have a need that is not being met and I can't communicate that to you. So it's definitely an appropriate referral. Also, for kiddos who are older, we talk a lot about social or pragmatic communication skills that we might need to communicate with others. This might mean, for example, I'm 14 and maybe I have an underlying medical diagnosis of autism spectrum disorder, and I have difficulty initiating conversation with my peers. I have difficulty maybe maintaining a topic that I want to maintain with friends. Maybe I even want to ask a girl or a boy out, and I don't know how. I can't get there because I have difficulty communicating that with my peers. I'm not sure how to have their perspective or take perspective taking on their side to be able to get inside their world and open myself up for them to be inside my world as well. So that would be another appropriate referral to have for any behavior concerns that are related to social communication difficulties in kiddos, versus maybe an example that maybe wouldn't be appropriate to send to speech would be, maybe I have a 13-year-old who talks back to me, okay, or we're just not getting along and we're having explosive issues at school where maybe we're just saying inappropriate things. That would be something that I would recommend that you talk to your physician about, to maybe, if they feel is appropriate, send you to a counselor, a psychiatrist, a psychologist, whatever they feel might be the need for that as well. Thank you so much for submitting your questions. We really appreciate communicating with the community about your kiddos and anything that we can do to help you. We would love to be able to help you with speech, language, occupational therapy, physical therapy needs.
So if you find any of these resources helpful and you think that they would be beneficial for your child, feel free to contact their primary care physician, and they can see if these resources would be helpful and necessary for your children. Feel free to contact Benefis. Thank you so much again for your time.